penile implant is perfect for you if you want to be sexually active, maintain that sexual activity, be spontaneous, and of course, functional erection. That's the perfect patient. Insurance is pretty variable across the board. For the most part, everybody needs to have their policies checked, and of course we do that here at the office. And currently Medicare does cover the penile implant, and we'd be more than happy to help you with that. There are a couple different types of penile implant, and it really depends on the patient. There is what's called an inflatable penile implant, and then there's a malleable or semi-rigid penile implant. A malleable penile prosthesis is something that is a little bit more rigid, that allows you to bend it up or bend it down depending on patient preference and obviously sexual activity. Whereas an inflatable penile prosthesis does use fluid to shift back and forth to create a rigid erection. We do have a reservoir where fluid is, and of course there's this pump which is going to be in the scrotum, and you use the pump to inflate or to deflate the penile prosthesis. This is a very common question. A lot of male patients are worried about the size of their penis, and are they going to get the appropriate size implant for them. So what I tell everybody is there's multiple sizes of implants, and they're all fit accordingly to you and your size and your girth. So intraoperatively, no matter how you're putting the implant in, surgically, at the time of surgery, we do induce an artificial erection. And after we induce that, we actually measure the inside of the penis, the length, both what we call distally and proximally, and there's a lot of penis underneath the pubic bone. And we find the appropriate size. You also make sure that a patient can receive the appropriate girth, and so we want to size that male for both his girth and length. The penile implant is very user-friendly. It is quite easy to operate, and of course we teach you. I teach you after surgery. We do give you a little model, we give you instruction sheets, and we make sure that every patient can operate it very, very smooth. But again, the principle's the same. There's a pump where essentially you're pumping fluid from a reservoir that does come into the cylinders of the penis, and you fill it up and you have your rigidity, your girth, your length, and when you're done with the sexual experience or activity, there is a deflate button on the pump that again is in the scrotum, and it's all concealed, and then you deflate the erection. I do tell my patients that this is one of the benefits of a penile implant, really. Your sensation in the penis is the same. Your ability to orgasm is the same. Of course, your ability to ejaculate depends on if you've had prior surgery or not, including prostate surgery. But yeah, that's the wonderful part of the penile implant. It's rigid, it's firm, it's hard, and whatever sensation and orgasm ability you have, you maintain that. The implant is totally concealed. This is a model that does have an implant in, and the cylinders are actually in the penis and the pump is in the scrotum. Of course, the reservoir is tucked inside. It's a little bit deeper, but the implant is totally concealed. There's no external parts or components at all. The implant is made of a material called BioFlex, and as you can see, there's no rubber. It is filled with saline. It is not filled with silicone. Yes, the implant is filled with saline. And the saline goes from the penile implant portion through the pump and into the reservoir. So during the surgical procedure, we decide which size implant is appropriate for the patient or for you. And that determines exactly how much fluid we need. Of course, we do give a little extra fluid. We don't want to leave anybody short. The penile implant surgery can be performed a couple of different ways. It is generally done through one single incision. Now, that incision can either be above the penis, it can be below the penis, in between the penis and the scrotum, or it can be done behind or underneath the glands of the penis. Generally, it's all done through that single incision. Again, at the time of surgery, we do give and perform an artificial erection, and that allows us to really evaluate the penis, not only the length and girth, but also for any potential curvature. Then, of course, you size the gentleman with the appropriate size, and then through that single incision, you're able to put the implant on the inside. You're able to put the pump into the scrotum, and of course the reservoir inside the belly. We do fill the implant with the saline and wash out with some antibiotics, close everything up, and of course we test it. We make sure that it works, and we make sure that it looks appropriate and it looks great. I tell most of my patients to expect at least 2 to 4 weeks of taking it easy and being sore. I just am not able to predict who does extremely well with this and who takes just a little bit more time. But I do want you to avoid heavy straining, heavy lifting for a good 2 weeks. Then we'll slowly get you back into activity, and that includes just your daily activities to lifting or weights or cardiovascular exercise, getting back to work. We try to get patients to inflate the implant around 2 to 4 weeks, and we try to allow them to use it around the 4 to 6 weeks. And really, it just depends on how well they are healed and how much swelling or discomfort they have in the penis and the scrotum. But yes, for the most part, as soon as the patient's comfortable, we let them, start inflating it and start using it. The penile implant is very durable, and we would hope that it allows you to have a lifetime of sexual activity and enjoyable sexual activity. The satisfaction rates for the penile implant are very high. They're in the mid to upper 90s percentage for both the patient and again for the partner. And don't forget, this is very important, and that is also a question we often get is, hey, what about the partner? What do they feel? What do they think? And yes, this has been studied, so it's absolutely fantastic. A penile implant is a surgical procedure. There are risks, as with any surgical procedure. With a penile implant, we do want to cover you with antibiotics, minimize the risk for infection. You're going to be sore afterwards. There's going to be some discomfort. We do see you quite a bit in the post-operative period and make sure everything is healing appropriately and you are progressing as expected.